Hello, the title of our paper is Environmental Impacts of Equine Parasiticide Treatment, the UK Perspective. I'm Callum Haseler. I was formerly affiliated with Rochdale's Equine Hospital, but I'm now with Dorset Equine Vets. There's growing concern over the environmental impact of veterinary parasiticide treatments. However, relatively little research has been published, and the studies that do exist have tended to focus on small animals and livestock. While the overall environmental impact of these products is unknown, negative ecological effects have been documented in multiple species for many of the same pharmaceuticals used in horses. But how big is the problem? Well, data published in 2019 estimated that there were just shy of 1 million horses in the UK, with around 1.1 million doses of equine anthelmintics sold per year around the same period. As far as we know, there are no similar data published on the sales of equine ectoparasiticide treatments, but blanket treatment with these products is less common in horses compared to small animals. For this reason, we set out to produce a review of current evidence around the environmental impact of equine parasiticides, with the aim of helping the equine practitioner to reduce this impact. Our review looked at two areas: firstly, endoparasiticide or anthelmintic treatments, and secondly, ectoparasiticide treatments. With regard to anthelmintics, drugs may be excreted unchanged or metabolized to other metabolites, either of which can have significant toxic effects on non-target insects such as dung beetles, earthworms and aquatic animals. Of the anthelmintics frequently used in horses, ivermectin appears to be the most ecotoxic, and available evidence indicates that moxidectin is less toxic, whilst fenbendazole appears to have little impact on dung-colonising insects, but may be toxic to aquatic organisms and fungi. There are very little data regarding the ecotoxicity of pyrantel and praziquantel, although their ecotoxic effects are thought to be low. Studies have shown prolonged excretion of anthelmintics in horse feces, with, for example, ivermectin remaining at a detectable level for over 40 days, and moxidectin for over 75 days after drug administration. Muck heaps may be contaminated with veterinary drug residues, although the persistence of anthelmintic drugs during manure storage and the impact on invertebrate biodiversity after spreading of manure on pasture are not well understood, and speed of degradation of these products is likely to vary considerably depending on product used and storage conditions. When compared to production animals, where feces are typically left on pasture, one key difference in horses is the widespread practice of pasture hygiene or poo picking. Pasture hygiene not only reduces the worm burden on the pasture, but also reduces pharmaceutical contamination. However, whilst management strategies such as pasture hygiene remain the mainstay of equine parasite control, the beneficial effects of poo picking need to be balanced against the negative impacts on invertebrates, including dung beetles. Current evidence is collated, and a series of recommendations are made regarding management strategies, pasture hygiene, and use of anthelmintics in order to reduce the environmental impact of these products. Secondly, with regard to ectoparasiticides, including fipronil, permethrin and cypermethrin, these products are again likely to have significant negative ecological effects, with a risk of contamination of both the immediate environment and watercourses following topical use. Fipronil, for example, is toxic to a wide range of invertebrate species such as bees and has high environmental persistence with a half-life of up to 7 months. Recent studies detected fipronil in a large proportion of English waterways, and it has been suggested that small animal pets may contribute to this contamination through several routes, such as dogs swimming in rivers or owners washing their hands after application of topical treatments. Whilst there's a lack of information regarding sales and use of fipronil in horses, given its toxicity for invertebrates, as well as the relatively high volumes needed to treat the equine limbs, its use is likely to have a significant environmental cost. The synthetic pyrethroids, cypermethrin and permethrin, have been shown to be toxic to dung beetles, bees, fish and aquatic invertebrates. These products do not typically persist in the environment, but in livestock the main environmental concern is from water contamination, most likely due to spillages and runoff from hard standing where treatment takes place. Of the licensed products, permethrin degrades at a faster rate than cypermethrin and may therefore have a lower ecotoxic effect. The ecotoxic effects of injectable doramectin are likely to be similar to oral ivermectin, although persistence in faeces may be significantly longer. Again, as for endoparasite treatments, current evidence is collated and a series of recommendations are made regarding use of ectoparasiticide treatments in order to reduce their associated environmental impact. We hope that this review proves informative to the equine practitioner and stimulates further debate and research in this area.